It is now 6 o'clock in the evening on Sunday, April 27th, and Reece is in St. Vincent's Children's Hospital. Actually, it's Peyton Manning Children's Hospital at St. Vincent's, and she has been here since Saturday morning at about 3 a.m. She was running a very high fever on Friday evening, and we checked her in. We finally decided that her fever was getting hot enough or high enough, and she started getting sick, started throwing up a little bit, so we went ahead and brought her in and found out that she has an infection, a kidney infection or a urinary tract infection, which is very serious for little babies under 6 months old. And you can kind of see her IV that she's got going there. They did that yesterday after we checked her in to give her antibiotics and make sure she's getting enough fluids. And she's actually in a very good mood. Yesterday she slept all day, probably to try to fight off some of that infection and that fever. And she's in a very good mood right now. She hasn't slept a whole lot today, and all the nurses and doctors think that she's kind of chubby. And she's lots of smiles today. We convinced Mom to go home last night and get some rest because Reece will probably not go home until about noon tomorrow. But she's doing a very good job. She's been a very good patient. She's happy right now. She hasn't fussed too much. She had an ultrasound yesterday. They did that to take a look at her kidneys, which they said looked good. They looked at her bladder, and she'll probably have maybe one more test tomorrow. But as you can see, she looks healthy. She's got some smiles right there, and she's doing well. Her mom did a good thing today when she came back and brought her glowworm. And Reece loves her glowworm. It brings smiles to her face. And that calms her down when she's actually crying. And she watches the glowworm, and she'll follow it. She sometimes even opens her mouth when you put it down, like it's going to give her a kiss. She loves the glowworm. There's some smiles. She does such a good job. And actually, look who just showed up. It's Mom. She actually went out to get something to eat.
Hi. Were you fussing? Hi, baby girl.
And once she gets a little bit better, we'll give you another update.